Accused killer Luigi Mangione remains in a Pennsylvania prison cell, but New York officials say they are eager to extradite him. A source tells NBC.
Most of the coverage about Luigi Mangione has focused on the shocking details of the crime. The unaliving of United Healthcare CEO Brian Thompson. Now, all that's extremely important, but today I want to take a different angle than a lot of the coverage that I've been seeing. Let's talk about what might have been at the root of Mangione's despair, his back injury. Reports suggest that Mangione suffered from spondylolisthesis. Now, this is a spinal condition that left him reportedly in constant pain. After a surfing lesson in Hawaii, for example, he was reportedly bedridden for a week. And in conversations with his roommate, he admitted that he couldn't get the treatment that he needed, but mentioned that the doctors weren't at fault. So let's break this down. What is spondylolisthesis? Why does it cause such intense pain? And let's talk about how gaps in the healthcare system leave so many patients feeling so hopeless. Spondylolisthesis occurs when a vertebra slips forward over the one below it. This causes spinal instability and nerve compression, potentially. This misalignment can lead to chronic pain, numbness, and mobility issues. Imagine your spine as a stack of blocks. If one shifts out of place, it destabilizes the whole structure. For someone like Mangione, this misalignment could have been a major source of pain and frustration. So, how does this happen? Well, here are the main causes. First, degenerative changes. Age-related wear and tear on spinal discs and joints. Second, stress fractures. Repetitive stress, which is common in athletes. And third, trauma. Injuries from accidents or heavy impacts. And lastly, congenital factors. Some people are born with spinal abnormalities that make them more prone to this condition. The symptoms of spondylolisthesis can range from mild to severe. Persistent back pain that worsens with movement, sciatica, which is sharp radiating pain down the legs, muscle tightness and spasms in the lower back, difficulty standing or walking for long periods. For Mangione, the pain was reportedly so intense that it sidelined him from normal activities, like surfing. The guy was 26 years old, so you can imagine that lower back pain like that probably limited him from a lot of activities that a young man would want to participate in. You can imagine that daily life may have seemed impossible with that level of pain. Now, the good news is that spondylolisthesis is treatable. But the bad news, as you can imagine, is that not all these treatments are equally accessible to everyone. Now, common treatment options include conservative management. This includes physical therapy to strengthen core muscles and stabilize the spine, pain medications or steroid injections for pain relief, and potentially bracing to limit movement and provide support. There are also surgical solutions, such as spinal fusion, to permanently stabilize the slipped vertebra. And in this case, there's been some x-rays circulating around the internet that show that Mangione may have undergone such a surgery. Decompression surgery could also be used to relieve nerve pressure. There are also innovative therapies in this area, cell-based therapies and things like PRP, which are aimed to regenerate damaged tissues. But these are often classified as experimental, and therefore they're rarely covered by insurance. And here's where it gets complicated. While there are options for treating spondylolisthesis, not everyone can get access to them. Now, reports suggest that Mangione struggled to get the care that he wanted or needed. He told his roommate that he didn't blame the doctors, but there were some systemic barriers, like potentially insurance denials or high out-of-pocket costs. These may have left him without effective treatments or with delays in his care plan. It's heartbreaking to think about how many people feel stuck in pain, not because treatments don't exist, but because they can't afford them or get access to them. Now, this is important. Spondylolisthesis isn't just a medical condition. I think it's a reminder of the challenges that so many patients in our country face every day. Luigi Mangione's story is an absolute tragedy, and I don't think that should be lost on any of us. But it also highlights a healthcare system that often leaves patients feeling abandoned. If you're out there living with chronic back pain, please don't give up. Seek help, explore your options, advocate for yourself. And for the rest of us, I think this story should be a call to action. We need a healthcare system that prioritizes patients over profits and makes even advanced treatments accessible to everyone. That's all I've got for you. Thanks for tuning in. Stay curious, stay compassionate, and as always, stay dynamic. I'll see you guys in the next one. Peace.